Hello everyone and welcome to my channel. If you're new here, I am a licensed foot specialist with over a decade of experience, and I want to showcase what professional medical nail care looks like. If you are into foot health, you are in the right place, so let's get started. Okay, so I'm popping in real quick to just tell you about this patient. This is an elderly female diabetic patient that comes to see me every 6 to 8 weeks for her nail care. Being diabetic, she doesn't want to risk cutting her own toenails and potentially causing an infection, so she feels more comfortable coming to see me to get it done in a professional and sterile manner. And we can also monitor for any changes within the feet, whether that's changes in coloration of the skin, whether that's corn developing, maybe an ulcer developing. That's the kind of thing that we monitor on a regular basis with everyone, but particularly for diabetic patients, is looking for any changes from week to week or anything suspicious that may pop up. So as you probably noticed, this patient doesn't seem to have anything wrong with her toenails. And you'd be right, these are non-pathological toenails, which is not normally the case for a diabetic patient. Normally, someone with diabetes, I'll see something going on with the toes. Usually it's fungus, or sometimes it's a retracted toe, some hammer toes or something, which cause changes to the nail. But this patient is lucky in the sense that yes, she has diabetes, but there's no concerns in terms of her nail or skin health. Everything looks quite healthy. For anyone who might be wondering, all of our tools are sterilized in between each patient, so no tool is used on a patient unless it is completely sterilized, and that is verified through steam sterilizer indicators as well as biological sterilizer indicators. So every single tool used on a patient is completely sterile. Packages are opened up in front of patients, and you can rest assured that you're not going to catch an infection from our tools because no dirty tools are used. Okay.
Yeah.
It's coming right up my leg.
Oh my goodness.
I've seen it before.
That's interesting.
Maybe that'll fix my foot. Little electricity.
Yeah. I'll get them.
Oh, really good.
Just a touch. There we go. Just to finish them off.
So now we have reached the end of our treatment where, as usual, I put alcohol first on all of the nails to wash away some of the debris, and then I put iodine on all of the nails to allow for an antiseptic solution to sit on the nails. Just helps prevent against any kind of infection. I want to thank you all for stopping by, and if you like this type of educational content, please let me know. Like, comment, subscribe, and I'll see you in the next video. Bye!